today we'll be going over how to use the paraffin bath as a therapeutic treatment modality. Some important things to consider once you decide to use the paraffin bath as a treatment modality are keeping a clean work area. Another thing to consider is the fact that the wax takes about 6 to 10 hours to melt. Finally, it's important to keep a thermometer in the paraffin bath. Most paraffin baths come at a set temperature that you're unable to alter, but this is just an important precaution to take so that you don't end up burning the patient. Now let's meet our patient. This is Mrs. Brown. Before we can begin this paraffin treatment, we need to check Mrs. Brown to make sure that she doesn't have any open wounds on her hands, such as this one. So we will not be able to use paraffin on this hand today. Sorry, Mrs. Brown. We also will be asking Mrs. Brown to remove any jewelry from her hands too. Mrs. Brown, would you mind taking your rings off for this treatment? Sure. It's extremely important to remember to always wash your hands before using the paraffin. So now, both myself and Mrs. Brown are going to wash our hands. Before beginning the actual paraffin bath treatment, it's important to make sure that you have all of your materials set out and ready for you. For Mrs. Brown, we'll be using this mitt and this plastic bag. Oftentimes, you can buy these to supplement your purchase of the paraffin bath. However, if you wanted to use at-home solutions, you can use a towel instead of this mitt and a grocery bag. Now that we've checked to make sure that all of the materials are ready, it's time to start the paraffin bath. So first I'm going to lift the lid and check to make sure that all of the wax is melted. And I'm going to stand behind her, positioning her directly beside the paraffin bath. I'm going to ask her to slightly abduct her fingers so that there's room for the wax to go and surround all of her metacarpal and phalangeal joints. I'm going to slowly guide her hand into the paraffin and have it sit there for about 3 seconds and then pull her hand out again. Are you okay, Mrs. Brown? Yes. 1, 2, 3. Now I'm going to continue to guide Mrs. Brown's hand back into the paraffin for about 8 to 10 times so that she has a nice thick coating of wax that covers her entire hand. While doing this, it's important to remind your client that they're not supposed to touch the side of the paraffin bath while this is taking place. After removing your patient's hand after the last dip, you should place your patient's hand in a loose-fitting plastic bag to help maintain some of the heat. Now you should loosely wrap a towel or a mitt around this plastic bag. Now I'll ask Mrs. Brown to sit down for 15 to 20 minutes with her arms supported and let the paraffin do its job. Now that the 15 minutes has passed, I'm going to ask Mrs. Brown to take this mitt off of her hand. Awesome. Okay, how did that feel, Mrs. Brown?
It felt very good.
Okay, well, can you take the plastic bag off as well?
Sure.
After removing the plastic bag, I'm going to encourage Mrs. Brown to wiggle her fingers to crack loose some of the wax. Can you wiggle your fingers for me, please?
Sure.
And I'm going to ask her to peel off the remaining wax and place it back into the paraffin bath. Now I'll encourage Mrs. Brown to wipe off her hand to get any remaining wax or oil off. After using the paraffin bath, Mrs. Brown is ready to participate in any therapeutic activity that is planned for the day.